Hey, my name is Matt Blois. You're listening to Medically Necessary, a podcast about the healthcare supply chain. On the show, I talk with experts, business leaders, and researchers about how we get drugs, devices, and medical supplies to healthcare providers and patients. This podcast is brought to you by Ryder, the only fully integrated logistics and transportation provider in the industry. Ryder's solutions cover the entire supply chain, including warehousing, transportation logistics, e-commerce fulfillment, and last mile. Discover how Ryder can make you ever better at ryder.com. Today, I'm talking with Dr. Hui Zhao, a researcher at Penn State University whose work has focused on pharmaceutical supply chains. She's been studying pharmaceutical supply chains for more than a decade, and starting in 2011, she started looking at drug shortages. Right now, the Food and Drug Administration currently lists more than 100 drug shortages. Shortages peaked around 2011, and since then, the numbers have started to decline a little bit. But then the coronavirus pandemic happened. Government lockdowns reduced production and supply. At the same time, patients streaming into the emergency rooms increased demand for certain drugs. On this episode, I'm going to be talking with Dr. Zhao about the fundamental reasons behind drug shortages and how the coronavirus pandemic affected those shortages and what we can do to fix the problem. Dr. Zhao, thanks for joining me on the podcast today.
You're welcome.
So I think a good place to start is just to get a sense of how big this problem is. So can you give us a sense of the scope? You know, how many drugs are normally in shortage and how many people might that affect?
Sure. Drug shortages have been a problem for the U.S. for more than a decade. Drug shortages, as you mentioned, they actually tripled from 2005 to 2010 and reached 456 in 2012. After that, it decreased, but started to increase again since 2018. And the number of active drugs on shortages have been about 200, actually above 200 at any point of time since then.
Great. I mean, I guess not great. That's not so good, but it's good to have that information to know, kind of what we're dealing with, what the size of the problem is. And so, what are the drugs that are most likely to run into shortages? What kind of drugs are they, and are they drugs that treat any specific diseases or problems?
Sure. So first of all, just a little bit of add-on to the scope of the problem. In early 2011, 99.5% of 820 hospitals surveyed experienced shortages, and nearly 50% of them experienced shortages greater than 20 drugs at any point in time. So that tells you, at that time how bad it was. And then more recently, according to a 2017 survey, of nearly 300 pharmacy directors, managers, and purchasing agents, we're not talking about patients. We're talking about these are the agents, the directors of pharmacies and managers. And then 75% of them stated that patient treatments have been delayed because of drug shortages. And 55% reported that more than 20 drugs, again, were involved in shortages during the 6 month prior to the survey. So now regarding your question about what kind of drugs are most likely to run into shortages, and these are mostly old generics, and a lot of them are injectables. So to give you a sense of old, so these are drugs on shortages has a median of 35 years since they were first marketed. And to give you a sense of, so these are, because they are old generics, so that means they have been long off patent, which means a lot of them are typically very cheap. I think most of us have been talking about drug prices being too high, but we also are looking at this set of drugs that are extremely cheap. And let me give you some statistics. So typical drugs on shortage costs less than $9 per dose. So that tells you how cheap they are. So what does that mean? So why are these drugs on shortage then? So first of all, because it's very cheap. This set of drugs are very cheap. So that means they're less attractive to drug manufacturers. So you would see most of these drugs have very few manufacturers who invested to produce these drugs. And then once you have very few manufacturers there, which means capacity to produce these drugs is much lower, is low. And then we also know that for drugs, they have long supply chains due to, a lot of the drugs are outsourced, and drug production is also very complex, starting from raw material. You have API, excipients, and all these have to come into play eventually to become the finished product drugs. So if in this long, complex supply chain, if any of the links or any of things goes wrong, again, because we don't have many manufacturers producing them, that means the drugs could be on shortage. So I'm talking about, say, raw material has a disruption, or in producing drugs, there's a quality disruption, and then you would have these drugs on shortages.
Yeah. So I'm hearing kind of two different things there. One is just the low profit margins. These are low price drugs that, these aren't the blockbuster drugs that you see commercials about. These are drugs that have, like you said, I think have been off patent for 35 years. Right. Yeah. And then the other part that's tricky about that is it's low margin, but at the same time, they are pretty complex to make. The supply chains are pretty, there's lots of different things going into these. The different raw materials are coming from different locations. And like you said, if any one of those gets disrupted, then you could end up with a shortage. I know another thing that I've read about that can be a big problem too is sort of related to that is that this is a highly regulated industry, and so you have to be paying really close attention to, do we have any quality problems? Do we have any problems that might cause a health concern? And so I've heard some reports that have pointed to that too, is, the fact that this is highly regulated. And if you catch something wrong, you got to stop and fix it, because this is, we're dealing with something that you really don't want to have any quality problems with.
Right. And plus that if there's something wrong, not only you need to stop and fix the problem, but also before you can get back to normal, you'd also, like, the regulators will need to come and re-inspect your facility again. So it's not like today you fix it, tomorrow you get into production again. You will have to, you will have your facilities or raw material or all those processes to be, looked at again, like inspected again. So those all make this unique,
Yeah, well, and speaking of inspections too, I wrote about this in the newsletter a couple of weeks ago, but I know that the pandemic has really made it hard for the FDA to go out and do those inspections, and I think they're kind of far behind where they'd like to be. So the pandemic has sort of made that tough too. So I wanted to ask about, that's kind of where the problem is, how big the problem is, what's some of the reasons behind it. I'm interested to know, what do you think some of the most promising solutions are? How do we fix these drug shortages? What can we do about it?
Sure. So, like, if you want to fix a problem, first you need to look at, what caused the problem. So, obviously, as I mentioned just now, incentive is a big problem, because, if these drugs are not of enough profit margin, then manufacturers don't want to produce them. So you got to think about ways to incentivize the manufacturers to produce these drugs. So that's first of all. So how do we do that? There are a few ways, and some of my research actually has been focused on this area. How do you incentivize? So one of the things that we have been advocating is that, look, these are just too low price, right? Can we look at this set of look at this set of drugs, right? And then reasonably increase the price, right? I'm not talking about over the board increase the prices of the drugs, but look at these extremely low priced drugs and then reasonably increase the price. But at the same time, with increased clauses to about fail to supply, the strengthened fail to supply clauses, which means that I am going to pay a little higher, reasonably higher price. At the same time, I'm asking you to give me more stable, more guaranteed supply of these drugs. So that's one of the things that we have been advocating, and we have done extensive research with data analysis to look into how effective this could be. So some other ways to actually, to incentivize more manufacturers to get into producing these drugs include, expediting approval process. FDA has been doing this, right? Or give some kind of tax breaks to the manufacturers who are willing to invest into these lower margin drugs, right? So that's one perspective, which is you incentivize. On the other side, we also talked about first is the margin, profit margin. On the other side, you also want to guarantee more resilient supply chain. As we talked about, supply chain has become longer, more complex, right? So are you able to, one of the terminology that we use in supply chain is that, are you able to map your supply chain? Do you know who produces each part of your drugs, right? API, and then what is the suppliers of to your suppliers? And this has been talked about not just for drug manufacturers, but for many other industries as well. Do you know, can you make your supply chain more resilient? And the third point I want to make is that, as in the other, I mean, different from the other consumer products, in the drug industry, we are not rewarding manufacturers with better quality in two sense. One is the supply stability, right? That's a quality. Like I have quality supply chain, which means that I'm going to be more stably providing or supplying my customers. And quality in another sense mean the more traditional quality, which is that, I'm investing into my quality assurance such that my facility or my production line would have a lower probability of getting into quality disruptions. So both of these would help. Currently, I don't think in the drug industry people are willing or are even aware of that. We are not paying for higher quality versus in other consumer products, like you would be willing to pay higher prices for better quality products. So these are the things that I think these are promising, and they should be the things we do.
Yeah. That makes a lot of sense. Well, and I liked how you divided it into there's sort of a carrot and a stick. Like you said, there's one of the problems that leads to these drug shortages is that profit margins are really low, and so there's not a ton of incentive for companies to go out and if they run into a shortage, it's a product where they're not making a ton of money on it anyways, and so it's doesn't make quite as much sense to go out there and on their own make these really resilient supply chains that are never going to fail. So, incentives to sort of deal with that problem is one side, but then the other side you're talking about is sort of the regulation side and seeing if you can figure out, okay, how can we require that these drug manufacturers make sure that their supply chains are resilient, make sure that they have multiple suppliers and ensure that happens. And so it sounds like there's a couple different ways to do that. And then I wanted to also go back to, you were mentioning the sort of the quality aspect there, because that's something that I've seen several people write about and several reports on drug shortages bring up is that one option is to basically grade drug manufacturers on the how reliable their supply chain is. And so if you're a drug purchaser, if you're a group purchasing organization that's trying to decide, okay, which manufacturer am I going to buy drugs from, you'd have some way to go, okay, well, I don't want them to run out of drugs. So this company or this manufacturer has an A+ supply chain, and this manufacturer has a B- supply chain. So they might run into shortages. So I'm interested in knowing, what do you think of that idea of grading the reliability of the supply chain, and how would that change drug shortages?
Sure. So we just talked about there are two aspects of quality. One is the quality of your supply chain, which means that you have more stable supply chain. You're more guaranteeing that your downstream have products. The other is the product quality per se. So you were talking about the first one, and I think that's very, very important just because it's easier to track because you can track fail to supply, right? I mean, in fact, in our research, we find there is fail to supply clause in many of these purchase contracts, but they're very nominal. They're very nominal in the sense that they just said that if you cannot supply, and then you can find the drug somewhere else. and then I'll pay the difference. But the problem is that during shortages, you can't find it somewhere else, right? You cannot find it anywhere else, which means those fail to supply clauses are there very nominal. But those are the things that it's easier to track than the quality measure itself, because in fact, for drugs, that I think we don't have public data for quality measures for different facilities. And FDA is working very diligently to establish that, which I applaud. But at the same time, just the other one is directly about supply chain. And then you could track their ability to supply, which is, easier data to obtain, because you have your past experiences with that, right? Mm-hmm.
Yeah. I think that makes a lot of sense. So I want to move on now to we've had quite a year over the last year, and it's actually had, from what I understand, a big impact on drug shortages. So I just wanted to ask about, what has been the effect of the pandemic on drug shortages, and how has it changed or not changed how we deal with them?
Sure. So basically, during the pandemic, shortages get worse for a few reasons. First is the sudden demand increase, right, for treatments related to COVID. And for these drugs, you see a huge jump, a huge hike of the demand. So even if you have a pretty good supply chain, this could cause potential problems, right? So let alone these are drugs that, especially for the drugs that are prone to shortages, this would really throw off the supply chain. So that's number one reason, which is the biggest reason: sudden demand increase for certain drugs. The second thing is because of, as you mentioned at the very beginning in the introduction, so there's a lot of production disruption due to lockdowns, especially not only here, but overseas, knowing that, as I mentioned, drug supply chain is very global, right? A lot of our APIs, a lot of these ingredients, raw material come from other countries. So you have a lot of that as well. And then the impact of trade for drugs produced outside of the US. To give you an example, I think a lot of us know the example already, right? India halted the export of 26 drugs and 13 APIs in the early stages of the pandemic, just to conserve these drugs for their own use. So these are the things that affect the situation, which makes the drug shortages become worse during the pandemic. So in terms of how has or hasn't this changed the way we deal with drug shortages, one very obvious one is that I think people are talking about drug supply chains more. And this is definitely a very good thing. So it becomes a very natural way of educating, making people aware of these problems. I think I mentioned to you before when we talked before this. Most of the people, everyday people, do not even know that a country like United States actually experienced drug shortages problem. We think that that's some problem somewhere else, but not here. But in fact, we have been suffering from this problem for more than a decade, right? So that means people are not aware of that. So first of all, people are more aware of that. I think that's definitely a good thing. Second, people are more aware about drug supply chains, right? So how many of us know that the APIs, some of the raw material come from other countries? We probably talk about other products, but not drugs very much, just because drugs are very unique and it's also more technical in terms of, these are medical stuff, right? So I think that's also a good thing. And the third thing is that, as I mentioned, the demand increase and the production disruption due to lockdowns, and then the impact of trade, it's not something distant now. Like, people know about this, so people actually understand better of this problem. So how does that have helped dealing with drug shortages? First of all, people are so now I think a lot of people are talking about establishing resilience in supply chain, which is very important. As I mentioned, that, because the drug supply chain is so long and complex, you really need to map your supply chain to get to know your supply chain better, to have your strategies of disruptions there. But as we mentioned today, right? the drug supply, the drug shortages problem is not just the resilience of the supply chain; it's also an incentive. So if just a few people, few manufacturers are producing it, even if you have very good supply chains, but you still could be prone to shortages just because too few people are producing this, right? So I think we still need, there's still a lot of work to be done in the incentivizing part to make it more attractive for the manufacturers to invest into these drugs.
Yeah, well, and I really like what you said about, it's interesting to think about one of the changes that has come out of the pandemic in terms of drug shortages is just that people are so much more aware of it. The general public is so much more aware of it. You know, this is one of the reasons that I wanted to write about this story, and one of the reasons I wanted to talk to you is I had been reading report after report about these drug shortages, and it really caught my eye, just sort of the frequency that that all of these reports were coming out. And I just want to ask briefly too, because I'm getting sort of at the end of my questions here, but I wanted to ask before we get to the end of the interview, given how much, this is a really big problem, and like you said, we've been dealing with it for well over a decade, and people are certainly talking about it a lot more right now. But how optimistic do you feel about the prospects of solving this problem? Is this something that's, now that we're devoting lots of attention to it, are we going to be able to deal with this problem in the relatively near future, or is it something that's just it's pretty complex? It's going to take a while to figure all this out.
Sure. I think we have a very good start now. People are more aware of this, right? And then this is now, a lot of people also agree. I think everybody agrees that this is a very important problem. It's not a problem that only, involves very few problems. It is a big problem. At the same time, we have to recognize the complexity of the problem as well. As I mentioned, this is not just a part of the supply chain and things like that. It is an incentive problem. And think about any incentive problem that especially involves so many different parties along your supply chain. Some of them are overseas, right? And then any time that you are facing incentive problems, it takes a little time, right? The good thing is that I think definitely we're on the right track, and there are many solutions being proposed. But I do think this will take a little while, just because we are looking at incentivized manufacturers. We're looking at aligning incentives along the supply chain such that everybody would work toward the same direction. And we're talking about for the drug supply chains, because you also have many of these intermediaries, and everybody will be aligned, and then they are actually their incentives are tied toward solving these problems, and that's going to take a little while, and then also for the market to kick in, right? So once you allow the some of these things to work toward that goal, you also would need to wait for the market to respond to that. For anything that market does not respond in a natural way, maybe some intervention, but those all will need to take some time.
Yeah, I think that makes a lot of sense. So I think this is going to be my last question of the interview. This is a way that I like to end my newsletter a lot of times too. Is I'll talk to sources, or I'll talk to readers and ask them, give them one wish. If they had a magic wand to change something about the healthcare supply chain, what would they do? And I'd like to ask you specifically about, the pharmaceutical supply chain. Like, if you had a magic wand, what would you want to do? What would be your one wish to improve or reduce the number of drug shortages?
Sure. Yeah, I would go to my favorite solution, which is the solution that I've been advocating, which is to reasonably increase the price with strengthened fail to supply clauses. I think that's very direct because it targets the incentive of the lower price. It also says that once you increase your price, I do want you to have something in return, which is better, stable supply of it. If I could have a second tap with my magic wand, I'd say the quality reward. I'd say the quality reward part, that the downstream should be willing to pay for better quality, meaning either it's already covered in the first one, like you're willing to pay for more stable supply, and you're also willing to pay for better quality facilities and things like that. Yeah.
Great. Well, I really appreciate your time, Dr. Zhao. This has been a really helpful conversation for me, and I hope listeners got a lot out of it too. So thanks so much for taking the time to talk with me today.
Sure, you're very welcome. And I also hope this is helpful to your readers and audience. And it's been a pleasure talking to you.
All right. Thanks so much.